we were really excited by the number of large randomized clinical trials that were presented at the World Stroke Conference. It was quite exciting, to see the results of many important studies that we think will be having high impact in the world. One of them was the tension study, which showed that using just a CT scan to identify patients with large strokes, that these patients can benefit from thrombectomy. And so, we think that this kind of trial will really help to substantially increase the utilization of thrombectomy in patients, even when they have a large stroke. And so, because that study showed that many of these patients will derive benefit from thrombectomy, even when the stroke is large. So that was very exciting to us to see that. And then there were two neuroprotection trials that were presented. And the concept here is one that's been under development now for more than 25 years. But there were two trials looking at the effect of Nerinetide, which blocks glutamate receptors in the brain. And the results, I think, were very intriguing. That I think that the investigators that were led from great colleagues in Canada were showing that if patients receive this drug compared to placebo very early on after the onset of a stroke, that these patients derive benefit and it can improve their outcome. But it's all about time. That the chances of benefiting from such an approach to protect brain cells is decreasing as time continues to elapse after the onset of a stroke. And so, and again, these are patients that many of them had received reperfusion therapy after that they received this neuroprotective drug. So we see overall from these types of trials that there is the potential really to, I think, help a lot of patients and actually receiving a treatment before they receive reperfusion therapy. So for instance, in the ambulance, before they even get to the hospital. So we're looking forward to seeing new trials that will confirm the efficacy of this drug in this patient population in the next few years. And if that were the case, then we've got a whole new treatment that we'll be able to offer these patients, something that could, I think, be very transformative and will really, I think, bring a great story that's been in evolution for so many years to try to really understand the treatment effects of neuroprotective agents. And then beyond that, there was also some exciting results in patients with brain hemorrhages that are due to anticoagulants. Unfortunately, some patients that can develop brain hemorrhages when they take blood thinners. And there was a clinical trial showing that there was an approach that can actually reverse the effects of that anticoagulant and reduce the expansion of those hematomas in the brain. This is the first treatment that I saw that may have that potential. And it's not straightforward because this treatment can also cause blood clots in the body. So, we're going to have to be very careful when we think about which patients to treat with this approach. But still, it was just exciting to see a number of positive trials at the conference and that the field continues to advance in stroke and cerebrovascular disease.